Good morning, everyone. Welcome to our seminar. I'd like to thank all of you for taking time out of your busy Saturday to join us. For our clients and our guests who are participating, I'm Dave Benson, President of DCB Insurance Services, and today's seminar is going to prepare you for open enrollment for individual and family plans, so you'll be in a better position to select a plan for 2016. Couple of housekeeping items before we get started. On the little box that's on the right side of your screen, if you have any questions, you can type them in. And at the end of the seminar, we will answer all of your questions. All of you are on mute, and we're going to go ahead and get started. So as I mentioned, this program is going to prepare you to make a plan selection for next year. You'll learn what questions to ask to determine if your doctor is a network provider for the plan that you select, and that is very, very important. Some of the topics we're going to be talking about are the Affordable Care Act, which is Obamacare, the different provisions in that act that apply to the individual market. We'll talk about the different insurance companies that are offering individual and family plans next year. We'll go through the different plan choices. We'll talk about Covered California, which is our state exchange program, premium subsidies through Covered California, the different provider networks, the enrollment process, and the plan effective dates. Under Obamacare, all plans are issued with no medical underwriting. It does not matter if you are perfectly healthy or have a whole slew of pre-existing medical conditions. A person with serious medical issues will pay the same premium as somebody that is completely healthy. We have different rating areas throughout the state. In the LA area, most of you are in rating area 16, some in a little different rating area, so the rates do vary by rating area. If you do have a pre-existing medical condition, it will be covered from the first day that your plan is in force. And I just mentioned about pre-existing. The open enrollment period to select a new plan will go from November 1st through January 31st. So during that period of time, you will schedule one-on-one meetings where we can talk about the different plan options for you and your family and help you select a plan. Once we get beyond January 31st, we have special enrollment periods. Those are for people who have lost their group coverage. In other words, you've left your job. Maybe you've been out of the country for a number of months and you've just come back. Or you've gotten married or divorced, or you're covered on a spouse's plan who passes away. These are all situations that create a special enrollment period where you can select an individual plan outside of the open enrollment period. This year, we have some new insurance companies, and we have one company that will be gone from 2015. Anthem Blue Cross is offering plans direct and through Covered California. Blue Shield of California is offering plans direct and through Covered California. HealthNet has some plans in Covered California as well as direct. Kaiser Permanente is offering plans. And our new entry into the market is Oscar Health. They've been doing business in New York and New Jersey for the last 3 years. They're new to the California marketplace. And when we schedule our one-on-one meetings with you, we will talk about the pluses and minuses of all these companies. United Healthcare has come back into the individual market, and in Covered California, they're only covering rural areas. So if you're in Los Angeles, that's not a rural area, so United Healthcare will not be an option for you. Now we're going to talk about the different plans. There are 4 plan levels: platinum, gold, silver, and bronze. And on the platinum plans, let's get into how those work. There's no deductible. The bills are split 90-10. That means the insurance company pays 90% of the bill, you pay 10% of the bill. Once your 10% share of cost reaches $4,000 during a calendar year, the insurance company starts paying 100% of the bills for the remainder of the year. $4,000 on the platinum plan is your out-of-pocket maximum limit. That's where you stop paying 10% and the insurance company pays 100%. When you go to the doctor for a routine office visit, that's where the doctor does a brief exam, like check your ears, nose, or throat. If you go in with a throat infection or an earache or stomach flu or something minor, and then the doctor will perhaps prescribe medication or a follow-up visit. Each of those types of visits are $20. Preventive care is your annual physical, annual female exam, and preventative cancer screenings. For women, that would include your mammogram. For people 50 or over, that would include your preventative colonoscopy. And for men in your 40s and beyond, it'll include your prostate exam. As long as you're using network providers, and it's billed as preventative, those services are all covered at 100%. With prescription drugs, a generic drug is a $5 copay. A formulary or preferred brand name drug is a $15 copay, and a non-preferred or non-formulary brand name drug is a $25 copay per prescription. This plan is ideal if you know you're going to have a lot of medical treatment coming up next year. Maybe that's the year you're going to go get your bad knee surgically repaired. Or for a woman, maybe you're going to start a family and you know that next year's the year that you're going to get pregnant. So the platinum plan works great for people that have a lot of medical issues or know they're going to have a surgical procedure or a pregnancy. That's where the platinum plan comes in really handy. The next level down is the gold plan. The gold plan also has no deductible. The bills are split 80-20, not 90-10. So the insurance pays 80%, you pay 20%. When your 20% gets to $6,200, you've hit the out-of-pocket maximum. And for the remainder of the year, as long as you're using network providers, everything is covered at 100%. In 2015, on the gold plan, the out-of-pocket maximum was $6,250. Next year, it's dropping a little to $6,200. Your office visit copays are $35 a visit. This year on the gold plan, those visits are $30, so slightly higher office visit copay. Your physicals and preventative cancer screenings are covered at 100%, and it's very important that you use a network provider because with most of the plans, physicals and preventive care is not covered out of network. On the prescriptions, the copays are much higher than on the platinum plan. The generic drug is $15, where on platinum it was $5. The preferred brand name or formulary brand name drugs are $50 each, as opposed to $15 on the platinum plan. And the non-formulary or non-preferred drugs are $70 per prescription, not $25, like on the platinum plan. So big difference. So one other thing to consider is if you're thinking, well, maybe I'll do a gold plan, maybe I'll do a platinum plan. If you're taking a lot of expensive medications, especially brand name drugs, you will make up the difference on the premium with the platinum plan because the drug copays are so much less. If you've got 3, 4, 5 or more prescription drugs and they're all brand name, there's a $35 difference in cost per prescription between platinum and gold. So that's something else to consider. Now, the gold plan has no deductible. So if you have a lot of chronic conditions where you're going to the doctor for blood workups every quarter, or you've got to go in for allergy shots every week, or something where you're seeing the doctor a lot, the advantage to the gold plan is there is no deductible, so you're only paying 20% of the cost if you're using a network provider. On the silver plan, you have a $2,250 deductible. This year, the deductible is $2,000, so it's going up. So that means that the first $2,250 in medical bills is coming out of your pocket. You're paying 100% of the bills till you reach the deductible. Once you reach the deductible, the bills will be split 80-20. The insurance pays 80%, you pay 20. Your out-of-pocket maximum limit is $6,250. So that's staying the same as this year. That $6,250 includes your $2,250 deductible and then the 20% on the coinsurance. Your office visits are $45. That's the same as this year. Now, with platinum, gold, and silver plans on the routine office visits, you have an unlimited number of routine office visits. So if you get the throat infection, the earache, stomach flu, or something minor, that's where these visits come in. Your preventive care, your annual physical and female exam, and preventative cancer screenings are still covered at 100% with network providers. Little change on the prescription. It's very similar to the gold plan. $15 for generic, $50 for the preferred or formulary brand name drugs, $70 for the non-preferred or non-formulary brand name drugs. But you'll notice on brand name drugs, both formulary and non-formulary, there's a $250 drug deductible. So if you're getting a brand name drug, you're paying 100% of the first $250. Then the $50 or $70 copays kick in. So one of the things that some of you will be doing is calling me and saying, you put me on this horrible plan, it's not covering my prescriptions. And we will remind you that you do have that drug deductible, and that is a per person deductible. Going back to the $2,250 deductible on this plan, there is a maximum of 2 deductibles per family. So if you're a family of 4, as soon as the second family member reaches the deductible, the deductible is then waived for the third and fourth family members. But let's say at the time the second person reaches the deductible, the other family members all have a few $100s toward their deductible. That money will not be refunded, but the third and the fourth family members will not have to satisfy any additional money toward their deductible. And with the out-of-pocket maximum limit, again, as soon as the second family member hits the out-of-pocket maximum limit, the remaining family members are covered at 100%. But the remaining family members will not have any money that's already been paid toward their out-of-pocket refunded. So maximum of 2 deductibles, maximum of 2 out-of-pocket maximum limits. If you have any questions on this stuff, please remember to write them down, type them in, and we will address those at the end of the webcast. The last plan is the bronze plan. This plan is going to be structured a little differently than in the last 2 years. You will have a deductible of $6,000. In 2014 and 15, there were bronze plans with a $5,000 deductible. So $6,000 deductible. Once you've reached the $6,000, all your medical stuff is covered at 100% of the network negotiated rate. So if you're using network providers, everything is covered at 100%. Your office visits are $70, but you'll notice that you're limited to 3 office visits per family member per calendar year. Now, a routine office visit generally costs around $100, maybe a little higher, maybe a little lower. So if you've used your 3 $70 visits and you need a 4th visit, that $100 plus or minus cost will be paid by you, but it will go toward your $6,000 deductible. Hopefully I was clear on that. If not, just send me a question and we'll address that again. Your preventive care, meaning your physicals and preventative cancer screenings, are covered at 100%, but remember you must use network providers. And the drug benefit is a little bit different. You do have a deductible on the drugs, and once you've satisfied the deductible, the plan will pay 100% of the drug cost up to $500 per prescription. So if you're taking a drug that costs more than $500, you will be paying 100% of that additional cost out of pocket. So if you're taking some really expensive drugs, this is not the best plan for you. With the bronze level plan, outside of your routine physical and your preventative cancer screenings and your $70 office visit, you are self-funding the first $6,000 in medical care. So this plan is ideal for the person that says, I have no medical issues, I rarely ever go to the doctor, I just want to make sure that if something unforeseen happens, I'm not wiped out financially, and your out of pocket is limited to $6,500. That's going up a little bit from $6,250. All right, let's talk about Covered California. Covered California is our state exchange. This was created under the Affordable Care Act, otherwise known as Obamacare. And in Covered California, there were individual and family plans, and there's also group plans available for small groups up to 50 employees. Now, carriers like Blue Cross, Blue Shield, Health Net, Oscar Health are offering plans in Covered California and out of Covered California. These are called mirrored plans because the benefits are exactly the same. The premiums are exactly the same. But outside of Covered California, some of the carriers are offering additional plans with different benefit designs that you cannot get in Covered California. Excuse me. The big reason for going into Covered California is if your household income is between 139 to 400% of the federal poverty level, you can qualify for a government subsidy to cover a portion of your premium. Now, I want to take a minute to talk about this because it sounds really cool, but you have to be able to guess what your income is going to be for 2016. So let's just use an example. Let's say you're a single person and you're projecting your income to be $25,000. And I'm making up a number now. Let's just say that the subsidy that you would qualify for is $350 a month. Well, the federal government will send that $350 a month to the insurance company that you select, whether it be Blue Cross, Blue Shield, Kaiser, Health Net, etc. You will pay the difference in premium. But now here's the fun part. At the end of 2016, if your income ends up higher than 25,000, you're going to be paying back a portion or all of that subsidy. And that has to be paid back by April 15th of the following year. And that money is going to our good friends, the IRS. And if that money is not paid back by April 15th, the IRS flips on the interest meter and you will owe a lot of additional money. So here's what you need to do. If you're that person at $25,000 a year and during the year you either change jobs or you get a pay raise or whatever the circumstance is where your income goes up, you need to immediately call Covered California and tell them there's been a change in your income status and have them adjust your subsidy. You'll probably still owe some money for the months that you received that subsidy based on the $25,000 income. Now, the way your income is determined, it's called modified adjusted gross income. That's a mouthful. When you're doing your tax return, the first part of the return is all the different sources of income you have coming in. The next section of the return are all of your deductions. When you subtract your deductions from your income, you get your adjusted gross income. But for modified adjusted gross income, you got to add some things back in to the adjusted gross income. If you inherited some money, if you have interest income or investment income, or you're getting income from mom or dad or some other relative, or you went to Vegas and got lucky and won a bunch of money gambling. All of those different sources of income have to be added back in to determine your modified adjusted gross income. And that's what they base this on. You also have to, when you apply for Covered California, you have to provide proof of income by submitting a copy of either your W-2s, your 1099s, or the last year's tax return. And you also now have to prove citizenship. So if you're a U.S. citizen, you'll send them a copy of your birth certificate or your license. If you are not a U.S. citizen, then you have to send in your green card or your work visa or whatever other document you have showing that you are in this country legally. So when you first go to Covered California, the website is www.coveredca.com. Again, www.coveredca.com. Up in the right-hand corner, it'll say log in. When you click on that, you can either then, it goes to a screen where you can enter your username and password, or it says set up an account. If you have not enrolled in Covered California before, you want to set up an account. And then you need to check that account after you submit the application because Covered California will put some outstanding requirements in there. Like they might say, you need to send us proof of income by such and such a date. So it's up to you to check your account every couple of days to make sure that you are sending them the required documents. If you don't do that, your policy will not get issued. Very important. Okay, so the premium subsidies, as I mentioned, are only available through Covered California. Now, for a single person, that means your income can be from about $16,400 up to just over $45,000. If your income is up at 45,000 or 44, 43, the subsidy you get is going to be very tiny or non-existent. It might be 30, 40 bucks a month. If your income is closer to the 16,400, you might get a subsidy for 500 bucks a month, depending on your age bracket and what your premium is. So, it's very, very important that you're conservative in projecting what your income is going to be. If your income falls below 139% of the federal poverty level, you're going to get this lovely letter from Covered California saying, we've terminated your coverage and you are now eligible to enroll in Medi-Cal. Well, when you're enrolled in Medi-Cal, there's no premium, but there are very few, if any, doctors that accept Medi-Cal in the middle and upper middle class communities. The doctors that take Medi-Cal are not necessarily in the best part of town, so you have to keep that in mind. If your household income is between 139% and 250% of the federal poverty level and you were applying for a family plan, which means one or two parents and any number of children, the parents will go into Covered California and get a subsidy. Your children will be automatically enrolled in Medi-Cal. So if your income is 250% of the federal poverty level or less, and there is a chart on the Covered California website that tells you what the income levels are for different household sizes. You can check that out, or you can call us and at my office and we will give you that information. So if you're in that situation and you will want to avoid having your children be enrolled in Medi-Cal, we'll have to enroll your children directly with the carrier and you'll have to pay 100% of the premium. That is the only way to work around that unless you can get your income up over 250% of the federal poverty level. Again, if you have questions on any of this, please write them down and we will address them. Let's talk about provider networks because since Obamacare started in 2014, we've had a lot of challenges with provider networks. A lot of the carriers have gone to what we call a narrow provider network. This is where they eliminate the more expensive hospitals and the medical groups that work at those hospitals. As an example, Cedars-Sinai and the Cedars-Sinai Medical Group. In the narrower networks, hospitals like Cedars and UCLA will not be part of most narrow provider networks. The full provider networks do include the more expensive hospitals like Cedars and UCLA. If you have an EPO, that stands for Enhanced Provider Network. And what that means is you're using the insurance company's PPO provider network, but there is no out-of-network coverage. Very important. And Oscar Health is only selling EPO plans this year in Los Angeles and Orange counties. If you are enrolled in a group plan through an employer, you still have the provider network that was in place in 2013. Most of the carriers had 60,000 or more doctors and hospitals statewide in their network. With the individual plans, a lot of the doctors opted out of those networks because the insurance companies wanted the doctors to accept a lower reimbursement fee. So in 2014, the companies that had 60,000 plus providers now had maybe 10 to 25,000 providers statewide. Over the last couple of years, those networks have grown a little bit, where now a lot of them have maybe 30 to 40,000 providers, some cases slightly more, slightly less. It is very, very important, if you're going to change plans, that you call your doctor and ask, are you a PPO provider for Blue Cross or Blue Shield or Oscar Health or HealthNet, and for individual plans? So the question is, are you a PPO provider for individual plans with Blue Cross, Blue Shield, HealthNet, etc.? It's very important to ask that, because your doctor might be a network provider on the group side, but not on the individual side. And here's the other problem that we have with provider networks. And that is, a lot of the doctors are telling their patients, yes, I'm a provider for Anthem Blue Cross or Blue Shield or Oscar Health or HealthNet, but we don't do Obamacare, meaning they are not a provider if your plan is written through Covered California. When they're telling you we don't do Obamacare, that means they don't do Covered California. Now, even though the plans are the same, the reimbursement to the doctor is the same, a lot of doctors feel that if people can't afford to pay their premiums, they're not going to be able to afford to pay their portion of the bill. And that's why a lot of doctors have opted not to accept that. If you enroll in a plan through Covered California, your insurance card will have the name of your insurance company, Anthem, Blue Cross, Blue Shield, etc., but it will also have a Covered California logo on your card. So if you're going to enroll in Covered California, you want to ask your doctor, are you a PPO provider for Anthem Blue Cross individual plans through Covered California? Very important that you ask that, or you might be in for a big surprise. If you were enrolled in a grandfathered plan, that means a plan that was around prior to March of 2010. March of 2010 is when President Obama signed the Affordable Care Act into law. If you were covered on a grandfathered plan, you still have access to the provider network that was in place in 2013 with the 60,000 plus providers. And if you decide to go to an out-of-network provider, you are going to pay a much larger portion of the bill. Let me give an example. Let's say the out-of-network doctor charges $100 for a treatment, and that same treatment with a network doctor is $50. Well, the plan is going to pay 50%, but it's not paying 50% of the $100 your doctor is billing. It's paying 50% of the network rate, which was $50. So in that example, the plan's going to pay $25. You're going to pay the other $75. But in many cases, your doctor might be charging $200 or $250. The network rate might still be $50. So that means the plan's only paying $25. You're paying the balance. So in most instances, when you're out of network, the plan is only paying maybe 10 to 20% of the total bill. That's why it's very, very important to use network providers whenever possible. The open enrollment period starts November 1 and goes through January 31. Any plan that we submit to a carrier by the 15th of December will be effective January 1st. If we submit the application on the 16th of December, it will not be effective until February 1st. So the 15th of December, the 15th of January are the cutoff dates. So the app submitted again by the 15th of December, your effective date is January 1. If your app is submitted by the 15th of January, your plan's effective February 1. If your app is submitted between January 16th and 31st, your plan will not be effective until March 1st. So just, plan accordingly so we don't run into any problems where you're without coverage. Now, during the open enrollment process, most of the carriers have online applications. Once we have our one-on-one conversations, you will decide on which carrier you want to go with. In most cases, we will start the application with you on the phone or here in the office, and then the application will be emailed to you to look over to make sure all of the information in there is correct. And you will have to select your payment option and put in your bank account information or your credit card information for the initial payment. And then you'll provide your electronic signature, and the app will go directly to the carrier. If we are going with a special enrollment period, meaning you enroll after January 31st because you lost a job, you have a new baby, you're new to the country, whatever the case might be, you have to provide proof that you are eligible for a special enrollment period. So you'll have to provide your certificate of credible coverage from your prior insurance company stating what date your plan started and what date it was terminated. Or you'll have to provide a letter from your employer saying your employment terminated on whatever date. If you were out of the country, you'll have to provide proof that you were in another country for a number of months. So that's really important. Now, what we'd like you to do beginning next week is call our office at 310 215 1222 and ask my office manager, Estella, to schedule a phone appointment for sometime in November. These time slots are starting to fill up, so it's important that you get in there early so we can get you taken care of by December 15th. The other thing that's really important is if you're going to be changing plans, you want to call your doctor and again ask them, are you a PPO provider for Blue Cross, Blue Shield, Health Net, etc., for individual plans or through Covered California? Now, if you are currently insured with Assurant Health, they are going out of business on December 31st. That's the last day you can submit a claim to them. So if you have an Assurant plan, you want to call my office, make sure we get you scheduled so you will have new coverage for January 1. HealthNet just recently got acquired by a new company that primarily specializes in the senior market with Medicare and Medicaid products. So a lot of their plans are going to be changing. Some of their plans are going away. If you were on HealthNet and you received a letter from them that your plan is terminating, make sure you call us so we can get you taken care of and you will not be without coverage. So again, really important, start calling into the office. Prefer that you call rather than email Estella because she's very busy right now, and we'll get your appointment scheduled. All right. Now, again, if you have any questions, please write them down, and we will start answering your questions here in just a second. We're just loading them up here on the screen, and should have them ready in one moment. Okay. Questions. Oh, it looks like we've got a number of them. Okay, first question. How is preventive care charged if the doctor is out of network? Good question. For your physicals and your preventative cancer screenings, you need to use a network provider. Most plans do not cover you for preventive care out of network. It's very important you use a network provider for those services. Very, very important. Okay, next question. What is the prescription deductible for the bronze plan? That's a very good question. I went through and did some research on that. I'm not sure if it's changing this year, but I could not find any information on any of the carrier sites with that information. I believe it is a $500 deductible. It might be $250. When we schedule your one-on-one meetings in November, we will have that information. Again, I apologize. I could not find that when we were doing all the research last week. Do all office co-payments and prescription expenses get counted toward both deductible and out-of-pocket maximums? Yes, they do. Everything now counts toward your out-of-pocket maximum. So that's a good question. So your office visit co-pays and your drug deductibles all count toward your out-of-pocket limit. Okay. Our daughter will start college in 2016. Will she be covered under her university's plan when she starts there? Very good question. Most universities do have a school health plan. What you have to do is you have to read the fine print in those contracts, because at some schools, they only cover you at the school medical center. Some schools do not cover you when you're in between quarters or semesters and you've left the school to come home. So you need to read the fine print. If the school has a plan that covers you year round and you can go to doctors outside of the school's medical facilities, then you're in good shape. If not, you're going to probably want to set up an individual plan just to be safe, so your child will be covered in between quarters and when they're traveling. Okay. My computer cut out when you said if you were in the 45,000 area, the subsidy. Okay, I'm not quite sure what that question is, but all I said was if you're a single person and your income is near the maximum of 400% of the federal poverty level, which is just over 45,000 for a single person. For a husband and wife, it's somewhere in the 60,000 plus range. For a family of four, it's up in the 90,000 plus range. So if you're right there at around 400% of the federal poverty level, the subsidy you get will be very small, if anything. It might not even be worth going through that hassle for that. Next question. What plans do you recommend to people who are 55 plus but very healthy? Well, that's something we'll discuss in our one-on-one meetings, but you could probably get by with a bronze or silver level plan. Now, keep in mind, you could be very healthy today. You could trip on a stair and tear up an ankle. You could be diagnosed with a serious medical condition. So you just need to be prepared if something catastrophic happens, that you're good with the plan that you select. But more than likely, the silver or bronze plan will work. Next question. Please review the info on EPO. All right, with an EPO plan, and for this year, we will not have EPOs with Anthem Blue Cross. They are going back to a PPO plan throughout the state. Blue Shield is also only doing PPOs. For those of you in Southern California, Blue Shield had PPOs this year, but Northern California, they had EPOs. With an EPO, the benefits are the same as on a PPO when you're using network providers. With an EPO, there is no out-of-network coverage. So the big problem there is if you're traveling outside of Southern California, you might not have access to providers. If you go to Arizona or to Las Vegas or to the East Coast or anywhere in the country and you're on an EPO, you will not have coverage. So it's important to keep that in mind. If I move from an EPO to a PPO with Blue Cross, and I know that my doctors are participating in a PPO, what are the differences between plan positives and negatives? Well, there's really one big difference, and that is you do have out-of-network coverage. So, every once in a while you could be somewhere and have a situation come up where you have to rush off to urgent care or to the emergency room. You are covered with that out-of-network doctor in the emergency room. Or if that urgent care center is not a provider on your health plan, you're still covered. That's the big difference. Which plan has the largest provider network? That's a very good question. Blue Cross this year has about 45,000 doctors in their PPO network. Blue Shield, I believe, has somewhere between 30 and 40,000. HealthNet's network is pretty small. They're using a very narrow provider network. And Oscar Health has a very small provider network. They're working with the Providence healthcare system, which means St. John's in Santa Monica, Little Company of Mary in Torrance, St. Joe's in Burbank, Holy Cross out in Mission Hills. So their network is a little bit on the small side. Okay. Should I wait for our phone conversation to ask about which company would be best for us? We have been on Assurant up till now. Yes. Keep in mind that if you are on a family plan, every family member has different medical needs. And it could be that on a family situation, the pediatrician for your kids might be a provider for one carrier, and your doctors might be a provider for a different carrier. We don't have to have every family member on the same plan. There are no more discounts for doing a family plan. Under the terms of Obamacare, every family member is rated based on their age. So if you have one spouse that's 35 and another spouse that's 45, back in the olden days of 2013, we would base the rate on the 35-year-old. Now, the 35-year-old's rate will be based on that person's age. The 45-year-old rate will be based on the 45-year-old age. So we will look at that on a case-by-case basis. Do all providers provide out-of-network PPO plans? Yes, PPO plans do include out-of-network benefits. It's only EPO plans that do not. What is the maximum out-of-pocket for prescriptions for the different plans? Well, the out-of-pocket maximum is your is the same as on the medical. So if you get to 4,000 on platinum, 6,200 on gold, 6,250 on silver, or 6,500 on bronze, you've hit the out-of-pocket limit. Do plans outside of California Care have restrictions for pre-existing conditions? No, there are no restrictions on pre-existing conditions. Under Obamacare, remember Obamacare is a national bill, um, there are no more pre-existing conditions. Your premium cannot be rated up because you have a pre-existing condition, and all pre-existing conditions are covered the day that your plan becomes effective. With brief meeting, EKG, and taking a blood test, and the second for future physical exam and review of blood tests, we end up paying for the second visit. Why? Okay. So in other words, if you have a physical exam and the doctor finds something and has you come back in and does further testing or takes more blood, that is no longer a physical. The reason they would have you come back in is some of your numbers were outside of the normal levels, whether it's your blood sugar, your lipid panels, or whatever else. So now they are treating you for a specific condition, and that cost will go toward the deductible or be covered under the 90/10 or 80/20. For the bronze plans, if you have reached the out-of-pocket maximum for the year, and you still pay the amount of prescription drugs that exceeds 500 per script. Yes, you will, because on a bronze plan, you were limited to $500. If you were taking a drug that cost more than $500, you were better off jumping up to at least a silver plan. When will the 2016 plans be loaded into your online quoting system? All plans will be loaded in late in the evening on Halloween, and we will start showing the plans. We will have the plans and the rates on November 1st. Which plans do paperwork better? Please also talk about Cigna. Okay. As far as handling, I'm assuming by paperwork you mean claims and all of that. Keep in mind that if you are experiencing a claims issue, you should call my office. Get my office manager, Estella, involved. She can get to the right person at the insurance company to get your issue resolved. If you try to handle it yourself and the person that answers the phone really isn't qualified, you could end up getting very frustrated and deal with a lot of different people. There was another part to that question, and I'm blanking out on. Oh, Cigna. Cigna just recently got acquired by Anthem Blue Cross. The merger will be finalized probably sometime during the second quarter of next year. We have not heard anything from Cigna about any individual plans. I am assuming that they are not going to be offering plans in 2016. So if you do have Cigna, you will want to give us a call so we can move you somewhere else. Do the same problems with Blue Shield post-Obamacare still exist? Many of our providers had dropped them. Well, as I mentioned earlier, the insurance companies are working very aggressively to bring a lot of those doctors back into the network. Some doctors are steadfast that they are not coming back in because the reimbursement levels have been reduced and they just feel that that isn't acceptable. But Blue Shield's network has grown over the past year, and just like with the other carriers. The good news with Blue Shield is they now have UCLA and Cedars in their network, as well as the UCLA Medical Group and the Cedars-Sinai Medical Group. Same with Anthem Blue Cross. So a lot of the hospitals and medical groups that were not covered in the past have come into the network during 2015. Okay, was that it? Okay, I think that answers all of your questions. If you have any other questions, feel free to call me or send me an email, david@dcbins.com. And please remember to call our office at 310-215-1222 to schedule an appointment for November 1st or later. Thank you all for attending the webinar today. I really appreciate it. Enjoy the rest of your day.